Pregnancy is just full of questions, isn't it? And a big one, a really stressful one for a lot of people, is about medication, specifically low-dose aspirin. Your doctor tells you to take it for months, and then all of a sudden, they tell you to stop. It's totally understandable why that would be confusing and even kind of scary. So let's just get right into it and clear this whole thing up.
Okay, this is a heartbreaking question. Someone actually shared this, and it hits on this deep, deep fear. The idea that maybe following your doctor's advice could have caused something so tragic. It's a terrifying thought. So we're going to tackle this head-on with the facts to really understand what's happening here.
So let's just put the question right out there, the one that probably keeps a lot of you up at night. Does stopping low-dose aspirin actually cause fetal loss? Is there a direct link? That's what we need to know. And the answer, and I want you to really hear this, is no. In the vast, vast majority of cases, the answer is a clear no. Stopping aspirin when your doctor tells you to is not the cause. But I know, just hearing no isn't enough. To really feel that reassurance, you need to understand why. And that's what we're going to do next. Okay, so the whole reason it's safe to stop really boils down to one absolutely critical difference. And that's the reason why you were taking it to begin with. We're talking about prevention versus treatment, and trust me, this distinction changes everything. So have a look at this. It's super important. The chances are, if you're watching this, you were put on low-dose aspirin as a preventative measure, right? It's a precaution. The idea is to improve blood flow, get more oxygen and nutrients to the baby, and help head off things like preeclampsia. Now, that is a whole different ballgame from someone who needs it as a treatment because they have a diagnosed blood clotting issue. They'd be on stronger stuff, and stopping for them is a much bigger deal. But for you, on that preventative dose, stopping is actually part of the plan. It's the standard, safe procedure. All right, so if it's safe to stop, why then? Why at that specific time? Well, it's not random, I can tell you that. There's a very clear timeline and a very important safety reason behind it, all tied to getting you and your baby ready for delivery day. Okay, so here's how it all plays out. For most of your pregnancy, let's say from week 12 all the way to around week 36, you're in what we can call the protection phase. The aspirin is your little helper, making sure the placenta is working great, getting all those goodies to the baby. But then, as you get really close to the end, usually around 34 to 36 weeks, your doctor says, okay, time to stop. And why? It's really simple. It's for your safety during delivery. Birth, whether it's natural or a C-section, involves bleeding. And stopping a blood thinner beforehand just makes sense, right? It's all about reducing the risk of bleeding too much. It's a safety measure for you. So hopefully you're feeling a bit better about the aspirin thing. Now that we can put that specific fear to rest, we can shift our focus. Let's talk about the real things, and they are rare, I want to stress that, but the things you should be paying attention to in those final months. So one thing doctors keep an eye on is something called placental aging. It sounds a little scary, but it's basically a natural process. Think of the placenta as this incredible lifeline for your baby. But just like anything, toward the end of a long, hard job, it can get a little less efficient. The analogy of a caregiver getting tired after a long journey is just perfect. They're just not delivering that plate of food as well as they used to. And the good news is your doctor can see this. They use a Doppler scan to check on the blood flow and make sure everything's still working as it should. Which, of course, leads to the big question, right? If it's not the aspirin, then what should we be looking for? What are the actual warning signs that we need to know about to keep our baby safe in those final critical weeks? Okay, so there are really three main things to keep on your radar. First, what we just talked about, issues with the placenta not getting enough nutrition through. Second, any kind of untreated infection. You never want to let that go. But honestly, the number one most important sign, the one that you are the expert on, is any change in your baby's movement. And really quick on the infection front, because this is important. You don't have to be a doctor, you just have to be observant. If you see any discharge that just doesn't seem right, we're talking green, yellow, or that clumpy white cottage cheese texture, don't hesitate. Just call your doctor. It's always better to check and have it be nothing. Okay, let's take all this information and turn it into something proactive. This is not about making you worried. This is about empowering you. This is your action plan for being your baby's #1 advocate as you head for the finish line. If you take away just one thing from all of this, let it be this. Your baby's movement is the single best sign you have of how they're doing. Seriously, it's like your own private language with them. And the logic behind this is so simple and makes so much sense. I mean, think about it. When you're fasting or even just really hungry, what happens? You feel tired, sluggish, low on energy, right? Well, it's exactly the same for your baby. If that nutrition supply line from the placenta starts to slow down, their energy is going to dip, and so their movement slows down.
It's a direct signal from them to you saying, hey, something's up in here.
So, how do you monitor it? It's a really simple 3-step plan. Step 1, establish a baseline. Just get to know your baby. Every baby has their own little dance party schedule. Learn what's normal for them. Step 2, notice a change. Is their dance party suddenly a lot quieter? Are the movements weaker or way less often? Pay attention to that shift. And step 3, and this is the most important part of all, act immediately. Do not wait. Don't think you're being a bother. Just call your doctor or head in to get checked. Your gut feeling is your superpower here.
And of course, there are things you can do to support healthy pregnancy all the way through. You know the drill, a good, balanced diet with veggies, protein, those important omega-3s for the baby's brain. And trying to keep an eye on high sugar and high salt stuff is always a good idea because it helps with blood pressure, and good blood pressure is great for the placenta. See, it's all connected. So, at the end of the day, what's the big takeaway here? It's that you are your baby's greatest advocate. The most powerful tool for keeping them safe is you, your awareness, your connection to them. So count those kicks, trust your gut, because you are, without a doubt, your baby's most important guardian.